Hello guys, welcome to my YouTube channel. I am super excited to be here as always. So today I want to teach you how you can check your blood sugar level at home. Okay, if you have the machine and it has been in your house lying around, you don't know how to use it, or even when you use it you don't know what the figure means, I'm going to be teaching you that in this video today. Okay, so if you have uncles, aunties, parents, grannies at home, you know you can give to them blood sugar measuring machine. It's not too costly. Yes, it's not too costly, and you'll be helping them, okay, monitor their blood sugar, because people are too busy. Sometimes they may not have the time to go to a nearby pharmacy to check, or by the time they close from work they are too tired. And some people, is until they get sick and they get to the hospital before they get to know their blood sugar level. And the problem is that if you get to know late, it is not good at all. One thing about diabetes is that if you don't discover it early, it affects your kidney, affects your heart, affects your eyes, these very vital organs, and we don't want that. In fact, you don't want your loved ones to come down with such ailments. That is why it's good to detect early. Also, some people, in fact, in the course of my practice, it's just one day like this that I've seen a young girl, like 24 years, walk into the pharmacy and says she wants to check her blood sugar. And I was like, did the doctor ask you to check? She said no, she just wants to check. It's good to check. I said wow, because most times people that come in to request for it to be checked are elderly people, or they brought their parents, people that bring their parents, because young people don't believe that they can actually come down with diabetes. But actually, young people can come down with diabetes. In fact, the most worrisome thing right now is that young children come down with adult type diabetes, that is type 2 diabetes, which is not supposed to be so. These days, you find out that some children now have resistance to insulin, which is type 2 diabetes. I'm not talking about diabetes today. Of course, it's a broad topic and it's something that I have to talk about in some other time. So today I'm just going to be showing you how you can comfortably relax in your house and take your sugar reading without going to the hospital or coming to the pharmacy. Okay, you just check in your house and you know what it is. Then I'm also going to be telling you what the readings are. Okay, so let me get straight to it. There's two types that you can actually do: fasting blood sugar and postprandial blood sugar. The fasting blood sugar is blood sugar that you take without eating anything, 8 to 12 hours. Okay, 8 to 12 hours. You can check if you're not eating anything at all. You can check. Postprandial blood sugar is blood sugar test that you run 2 hours after eating. You have to wait till 2 hours after eating. Now the thing is, if you wait 2 hours after eating before you run your blood sugar test, which is postprandial blood sugar, of course, it should be below 140 milligram per dl. But fasting blood sugar should not be above 110. That's 110, because 110 is the upper limit. So if it passes 110, the person is tending towards pre-diabetes. Okay, so that is even why you should check, so that you know your status, you know where you stand. So having said that, let's get started. So what I'm using is Encore. Actually, this is the pen and this is the strip. I'm using Encore. This is the strip and the pen. This is the machine itself. This is the pin. This is the spirit to just clean your fingers, and this is cotton wool. So I'll be showing you how to go about it. But before you start, you have to check the battery. You can see how I brought out this battery. You can see how I brought out this is how I stored this battery. Like this battery is not ready. You can see this is the proper way to put the battery, but I didn't put it like that because it was not on use. As I'm using it now, I've put it the proper way. And when you are putting it, you check the cross. Okay, if you can see, there's a plus sign on this battery, and there is a plus sign on the machine. So this two plus sign has to align. Okay, you make sure that the two plus are in the same place. If the plus is here, the other plus should be there too. Okay, so that is how to put the battery. And when you are done, you turn it the other way so that it doesn't run your battery down. And some people have come to ask me where they can find this kind of battery. You can find it in supermarkets. Yes, it is the pen that houses the pin. This is the pin. When you pick the pin like this, it's sealed. The pin is sealed. So what you do, you insert in the pen and you remove the cap. Okay, even when you go to the hospital, you see them doing it. If they don't do it like that, it means it's not a new pin and you have to request for it to be changed. So that is it. You cover it back, then you set you can see the numbering here is to set the piercing according to how strong or soft your finger textures are. If it's soft, then it should be lower, but if it's not soft, then it should be at 5. You see there's an arrow here, there's an arrow there, and that is where this 5 should be resting. The 5 is resting at the arrow. You pull here, so by the time you pull here, this pen is ready to pierce your fingers. Don't worry, it's not painful. Yeah, some people will be jittering when you want to check them. They are jittering. No, you don't even know when you pierce yourself, trust me. And when you want to pierce yourself, all you need to do is to place it like this and you press on this button. Okay, I'm going to do that soon. Okay, this is the strip. So when you take it, you can see it has a small indication here. Okay, this indication is where the blood will be sucked from. Right is where you are inserting. So this is going to be outside and this is going to be inside the machine. So we insert like this, and immediately you insert, after a few seconds you start seeing indication on the machine that is saying you can put blood on. If you can see properly, my machine is showing an indication that you should put on the blood. 172 you are looking at there is the code. Is the code of this particular machine. Normally I use my thumb when I'm doing this. You can use any finger of your choice. Guys, you wipe your finger, the particular finger you want to use. After wiping it, you just make sure you've already, for those using Encore this type, you pull at this place. So when you do that, you bring it close, you bring your thumb and the pen close, you just press on this button like that, and that's all. So you can see blood is already out. So that is it, guys. Yes, mine is reading 66 milligram per dl. That's because I'm not actually eating well today. Yes, I'm not actually eating well today, so that's why it's this low, 66 milligram per dl. By the time I eat, it will shoot up again. Exactly how to measure your blood sugar level. Thank you for watching. Till I come your way next time. Bye.